Hi, I'm Jack Cush, coming to you from MICO, the Milan Convention Center here in Milan, and the site of EULAR 2023. Just got back this morning from an interesting session on the APIPPRA study. As you know, this is the long-awaited preclinical RA intervention trial that was presented here this morning by Andy Cope. A really good presentation, a really industrious project that began almost 10 years ago. They've been enrolling patients in this early preclinical RA study since 2014. They enrolled 206 patients where they were treated with either abatacept 125 milligrams weekly or placebo. That was done for 52 weeks. They enrolled patients who had arthralgia, no synovitis, no swollen joints, and they had to be seropositive with APIPPRA or CCP or rheumatoid factor. These patients at enrollment were relatively mild. They had on average 2 to 3 tender joints, no swollen joints, very low SED rates in CRPs, and although I think the number was about 90% were APIPPRA positive. So what did they see? In the first 52 weeks of blinded therapy, patients treated with abatacept had less progression to inflammatory arthritis. Again, you were said to have a positive outcome if you developed RA by criteria or if you developed 3 swollen joints at a time. So the rate at 52 weeks was like 6% on abatacept and 29% on placebo. At the end of 52 weeks, the patients were then all taken off therapy, meaning half were taken off abatacept, everyone else continues their baseline therapy. And at year 2, the rates start to merge together. Again, about a higher rate, like 35% for placebo and 30% for the previously treated abatacept group. The point being, in the first 52 weeks on therapy, it looked like the drug was preventative. But off the drug, it looks like the drug exposure for 1 year delayed the onset of disease. And that was important. How much did it delay it? On average, it was about 99 days across the board. The other interesting thing about the results was that the more autoimmune you were, meaning if you had a multiplicity of autoantibodies, including APIPPRA, rheumatoid factor, they looked at a few of them, I want to say CAR-P antibodies, etc., the more likely you were to have a preventative effect of abatacept, and the more likely you were to quickly develop RA if you were on placebo. So there's a message here, and the question is, how's it going to be spun? Moreover, while it looks like it delayed the onset of disease, what's going to be the long-term implications of that? Does it change the trajectory of disease for those who do develop arthritis? Interesting data nonetheless. Remember, APIPPRA positive individuals presenting with arthralgia, about 30% go on to develop rheumatoid arthritis. In this study, that's the number that was in fact seen. So being exposed for 1 year to abatacept delayed that, but then there was a catch-up at the end, although the lines never fully came together. So I think this is going to be debated. You'll hear more from ACR on the APIPPRA study. Take care.